Hi, good morning, everyone. Thank you so much for joining us today for an immigration policy update with the California Immigrant Policy Center. My name is Diana Garcia. I'm a data and policy analyst here with First Five Alameda County. First Five is committed to advocating for and achieving equity by focusing on racial and economic justice to ensure that all children in Alameda County are born healthy and that community and family conditions exist to support well-being and growth. This includes advancing programs and policies that respect the lived experiences of the historically marginalized communities, including our refugee, immigrant, and undocumented families. So First Five is really pleased to host this educational event. The views presented today are the speaker's own views and do not represent First Five's point of view. And with that, I'm excited to introduce Daniela Alvarenga, Ivan Barragan, and Benjamin Chow, whom are joining us today from the California Immigrant Policy Center. Today, we will be hearing an update on the three pillars of the state efforts to advance the health and well-being of immigrant families and highlights of changes that were made through this year's state and legislative budget process. We'll be starting with the update on the Health for All campaign, followed by the Food for All campaign, and then continue with an update on the Safety Net for All, and time for question and answers at the end. So with that, I'll let Ivan take it away.
All right. Thank you so much, Diana. And thank you, everybody. Good morning. Thank you all for being here today. My name is Ivan Barragan. I'm going to go ahead and share my screen. You all should be seeing that now. Just very quickly, the three campaigns that Diana just mentioned, we collectively at CIPC, we call it our Immigrant Equity Budget. And it's an evolving thing every year. I'm sure we're going to add stuff to it to make it more manageable, but also more equitable to immigrants. But I noticed on the survey that some of you filled out that not a lot of you have heard of our campaign. So by all means, do not be shy to share questions in the chat if you have any. Like we were saying, we'll answer them at the end. But we did just want to give you guys a basic introduction into what these campaigns are and how they benefit Californians. So before I get started, I just want to give a little bit of a background of like who CIPC is, the California Immigrant Policy Center. We're a constituent-based statewide organization. We have offices in LA, Sacramento, Oakland. We're the premier immigrant rights institution in the state, and we advocate for policies that uphold the dignity and basic human rights of immigrants throughout the state. And so the way that we do that is by passing legislation at the state level that we're going to go into right now. Before we get started, though, I do just want to give a brief background into like who is a Californian, like who do we consider to be a Californian. Undocumented immigrants mostly are shut out from a lot of public programs, but they're roughly 2.3 million out of our 35 million or so Californians. And some of these numbers are a little bit outdated, so forgive me, haven't updated them, but you get the picture. They represent about 10% of our workforce, and they contribute about $182 billion a year into California. That's through taxes, but also, they're just purchasing power in general. They're also a critical part, of course, of our economy, right? Essential workers, that was the big, sort of catch-all term during the pandemic. They were disproportionately represented by undocumented immigrants. They're the social fabric of this country, but many of them remain, like I said, excluded from the public benefits that we're talking about today, actually. Okay, so now I can talk about Health for All, right? What is Health for All? What is this campaign? This campaign, brief history. We aim to remove immigration status as a barrier to health access, in short. But just going a little bit here into the details of it, just so you all understand what it is that I'm talking about. The Health for All campaign has so far lobbied to expand the Medi-Cal program, which here in California, that's what we give the name to the federal program known as Medicaid. So if you hear those two words, they're the same thing. This program was established back in 1966, right? It's basically state-funded health insurance for folks with low income. And California has, well, not the only state, but California has taken a lot more steps than other states to fund this program, because Medicaid is a joint state and federal program. And so we're able to use our own state dollars to expand the program to basically whoever we want, without the need of federal dollars. And so that's how we've gotten away with healthcare expansion. But that being said, there are still about 750,000 immigrants without health insurance between the ages of 26 and 49. Of course, there are exceptions, like if you've heard of restricted Medi-Cal, that's basically just Medi-Cal that covers only emergency services. And if you're pregnant, of course, you can go on the Medi-Cal program and get all the services that you need. That's a little bit of background to like what Medi-Cal is and how it operates and how we're thinking about this. But in short, right, the Affordable Care Act, or also known as Obamacare, I'm sure you've all heard of it by this point. It's a lot of regulations. It's a lot of things that went into that. It was signed in 2010. The Affordable Care Act, in short, it established two things. It established what are known as healthcare exchanges, which is basically a market where you can purchase your insurance with subsidies from the government. Here in California, we call that Covered California. So if you've heard of it, this is because of the Affordable Care Act. And there was also another component known as Medicaid expansion. Again, we call it Medi-Cal. Basically, it expanded this Medicaid program to anybody under a certain income limit. Previously, there were very, very stringent regulations on who could sign up for Medicaid. But nowadays, as long as you have documentation status and you meet the income threshold, you basically qualify for Medicaid. However, all this stands in contrast to the fact that undocumented immigrants were excluded from everything. They were not at all included in any of these benefits. Which harms a lot of people. About 2 million here in California, like we're saying, but probably millions more throughout the country were just left out of health insurance in general. And so, in 2013, California by then had sort of had this reputation of being pro-immigrant rights, and so there was a desire and, quite frankly, a need to go beyond what the federal government did, and see if we can leverage some state money or some state program to further the goals of the Affordable Care Act, which is universal coverage. And so in 2013, this coalition came together. CIPC is a co-chair. Our co-chair with the coalition is known as Health Access California. You may have heard of them. If not, it's totally fine. But all they do is lobby for health coverage and health access in general, as the name implies. And so it was like the natural sort of merging of the two organizations, immigrant rights and health coverage in one. And so the coalition set out to remove these exclusions. And I'll go into how that went in a little bit. But suffice to say that the coalition is a multifaceted community-facing membership. It's made up of public health practitioners, doctors, nurses, health providers, health systems, policy advocates like ourselves, but there are a lot of other immigrant and policy advocates in California, and of course, immigrant rights in general. So it's a multitude of organizations and individuals. We have about 180 organizations in the coalition to this point, and we've gotten actually a lot done. So this is a brief timeline, and these slides will be provided to you all, so you all can sit down and look at them if you want. But in its roughly 7 years of existence, we've actually gotten a lot done, a lot of first in the nation status things that we've done here in California. Starting off with Health for All Kids. This was the first campaign really that kicked off. This came to be known as KIDS because it expanded that Medi-Cal eligibility to all children under the age of 18. It went into effect in 2016. So a year after bills are signed, that's usually when they go into effect. And this benefited at the time, roughly, we estimate about 250,000 children, which is not a small number. We actually started advocating for everybody in the Health for All campaign, but a closed door behind the scenes negotiations usually ends up chopping things up in ways that we may not like, and so we ended up with Health for All Kids only, but the original bill was for everybody. And so the coalition recognized that, okay, maybe we need to chop this group, this entire group up and ask for certain age groups. And so we asked the coalition what they wanted after kids. And by and large, all of them actually said, older adults, seniors, or over the age of 65. And we as the coalition, the co-chairs, we also recognize that we could actually also do young adults, so from 18 to 26. And so the next couple of years, because Governor Brown didn't want to sign any more health for all, he's like, no, too much money. Let's wait. And so when we got Governor Newsom in office, he said, yeah, I'm game. Let's do it all. And so we ended up actually going with young adults first. He said, I'll do seniors the year after. I'll do young adults now, and then I can do seniors. And so, again, it's a political calculation that you have to do, but so we decided, okay, fine, let's go for a young adults first, and that was signed into law in 2019, and that went into effect in 2020, right before the pandemic began. So that was good for those young adults that they were not without health insurance during the pandemic. And then he said, okay, I'll do seniors next year, right, meaning 2020. But then of course the pandemic hit that year, and so all of our priorities sort of went out the window because it costs a lot of money, as you can imagine. And so not only Health for All, but I'm sure a bunch of other advocates campaigns were sort of, put on the back burner because they had to make sure that the budget was balanced. And so we didn't get seniors in 2020, which is kind of ironic. They were the most vulnerable group over the age of 65, especially undocumented immigrants. A lot of them don't have access to to other safety net programs like unemployment insurance or food assistance, which my colleagues are going to talk about. And yet we were not, giving them health insurance at that time. And so quite an ironic twist of fate. But nonetheless, the coalition said, we're going to keep trying next year. And we started off with, again, just asking for seniors, 65 and plus, coverage for those over the age of 65, I should say. But we started hearing at the end of 2020 that, actually there's a lot of money left over in the budget, that we might actually have like a historic surplus. So we might actually be able to ask for a little bit more than just seniors. And by the time the governor sort of came out with his budget proposal in May, he was proposing Medi-Cal expansion to everybody over the age of 60, which was better than 65. We had already moved on to 50 plus. So that's why we were calling it older adults instead of seniors. And, through some negotiations, he relented and he agreed to go for the whole older adults expansion. Luckily, again, the Senate and the Assembly were behind the coalition, and so they were also on board with that. So it was really the governor that had to move towards our position. But suffice to say, at the end of it, he signed the bill, which gave Medi-Cal to everybody over the age of 50, and that went into effect actually this year, May 1st. And we have about 280,000 people that are currently enrolled in the full Medi-Cal program. Which is pretty great. It's more than we were estimating. We thought about 250,000 people would be on it. So we have 30,000 more people that just enrolled in the past couple of months, which is always a good thing, for sure. Okay, so where are we now? We still need to update this slide on our website, but this year we were really thinking about, well, the last gap of 26 to 49-year-olds are ineligible for Medi-Cal. We have everybody under 26 and everybody over the age of 50. And so this last group of people, like I mentioned earlier, is about 750,000 people. It's by far the biggest group that we still need to cover. And in January, when the governor came out with his budget, he actually proposed just doing it all, everybody, by January 1st of 2024. And so, we were sort of, struggling with that. We were trying to get that implementation date a little bit sooner, since a year and a half is a long way away to wait for health insurance. Unfortunately, we were not able to move that implementation date up, but as signed into law at the end of July or end of June, it will go into effect in 2024. So starting January 1st, 2024, anybody in the state of California, regardless of immigration status, will be eligible for full Medi-Cal benefits, which is pretty great. And actually, one thing that was added just a couple of weeks ago was some protections that we had that we were lobbying for. So like the law is written, when you turn 26, you're no longer eligible for Medi-Cal. That's how the law is, right? That's how we're fighting for the 26 to 49 group. And so we were worried that once the pandemic was over, these young adults would be cut off from the program. But a couple of weeks ago, the state came out and said, no, we're going to keep everybody on Medi-Cal all of 2023. So nobody should be, disenrolled from that program just because of their age if they're 26. And so that's great. That protects about 40,000 people. We were worried that, folks would drop off next year and then be eligible again in 2024. And so, you'd have this flip-flopping and confusion, and that would be very bad for everybody, as well as, just continuity of care. And so thankfully, surprisingly, we got that through. And that's where we are with the coalition so far. Of course, we're going to be focusing on the implementation of this last expansion for the next year and 2 months, I want to say. We're already meeting with the department to make sure that it's implemented equitably. And yeah, so that's where we are with the coalition. We are looking at next steps because there are not a small number of people that are undocumented that earn too much money to qualify for Medi-Cal. We've had a lot of stories of people that they earn too much money. Like, what can they do? And so we're thinking about what's to come. So I don't want to spoil too much. We're still in the planning phase. So I'll leave that for the Q&A if y'all have any questions, and I can sort of try to answer that as best I can. But that about does it for Health for All. Been through a lot, 8 years. We've gotten a lot done. It's been a long campaign. But we're excited, we're setting sort of the standard for other states to follow suit. New York, Connecticut, Illinois are doing similar, state-based solutions to immigrant health. And so we're very proud of that. But with that, I'll hand it off now to my amazing teammate, Ben, to talk about, Food for All. Go ahead, Ben. Or do you want to do there you go. There you go. You should have access to the slides now. Thank you.
Thank you, Yvonne. And hi, everyone. Good morning. Again, my name is Benjamin Chow. I'm a policy analyst here at CIPC, and my focus is on access to nutrition benefits in California and addressing food insecurity. So I'll be talking today about Food for All and the efforts over the past 2 years to, similar to what Yvonne shared about advocates trying to remove the exclusions from Medi-Cal based on immigration status. Food for All is focused on removing those same exclusions, but from SNAP, the Supplemental Nutrition Assistance Program, or what we know in California as CalFresh, and what some people might know as food stamps, which is a really critical resource that helps keep people out of poverty and keeps people with food on the table. So I'll start by sharing, our best measurement of, how food insecurity impacts undocumented immigrants in California. Recently, CIPC and our co-sponsor Nourish California and the UCLA Center for Health Policy Research really looked into the numbers, and we found that 45%, so that's basically more than 2 out of 5 undocumented Californians are residing in a household that is impacted by food insecurity. And what's even more dire is that young immigrants, so immigrant children, have the highest rates of food insecurity, which is 64%, nearly 2 out of every 3. Just looking at these numbers, we recognize that there is a real inequity here, and immigrant communities are vulnerable to food insecurity because of low wages. Now we're seeing rising inflation, which is making it hard to afford food for everyone. But another reason is the CalFresh benefits for low-income people that's not available to people in undocumented households. And even before COVID, we found that more than 4 million Californians could not afford to buy food regularly. That's across the board. And so food insecurity is still a pressing issue in California for low-income communities. And it's really unfortunate given that California is the wealthiest state in our nation. And if we counted California as a country, we would be like the 5th wealthiest country in the world. However, that wealth that we have is not equally distributed, and we have high income inequality in California, and we also have the nation's highest rate of poverty. So this is really kind of the core of this issue, is that there's a lot of abundance in our state. However, there are some folks who are experiencing scarcity because they don't have access to the same resources. And what we're trying to do is making sure that folks do have that cushion to keep them afloat, and help them not just survive, but thrive. So a little bit more about CalFresh. I mentioned that it helps keep people out of poverty. I would consider it our most effective anti-poverty program. It's lifted over 700,000 Californians out of poverty every year by allowing them to buy food that they need when they need it. One other effect that CalFresh has is it frees up a household's income to meet other needs, whether that's paying the rent, paying utility bills, paying for medication, or just buying uniforms for your children or something like that. Research has shown that CalFresh utilization improves health outcomes, especially long-term health outcomes for children, by preventing incidents of other chronic illnesses later in their life. And by doing that, it also reduces healthcare costs by preventing people from experiencing those illnesses. CalFresh also generates economic activity. So every dollar spent on CalFresh generates about $1.70 in economic activity when you use it at the grocery store. And by creating a support, an additional support for communities, we found that it also reduces recidivism rates. Basically, the rate of people re-entering the criminal justice system after leaving it, and also may reduce rates of incarceration, especially for folks who are on CalFresh early in their life. So really, CalFresh, it's a very simple benefit, but I think we all know, what impact having enough to eat has on not just in our health, but our mental well-being, and our ability to just, pursue opportunities in our life. And as I mentioned, the problem here that we're trying to address is that many immigrants are excluded from CalFresh. So CalFresh is funded by SNAP, which is a federal program, and like with Medicaid and the Affordable Care Act, undocumented immigrants are left out of SNAP and are explicitly excluded. And that also includes DACA recipients, people with temporary protective status, and some additional visa holders. But one thing I'll note here is that for mixed status households, so for example, a household with undocumented parents but U.S. citizen children, those households can still receive CalFresh. They'll just only count the benefit for the eligible family members. So we really do want to make sure that families and mixed status families know that they can still apply, and it's okay if some members of the household do not qualify. And we're just trying to make sure that families are utilizing all the resources that are available to them. Yeah, and so leading up to 2020, this problem, seeing the momentum that Health for All had in the 7 years, we came together with Nourish California, which is formerly known as the California Food Policy Advocates. They're a statewide organization focused on food access. We started consulting with our community across the state, different regions across the state, and asked them, how do we solve the problem? And I think the solution is very simple. And I think everyone at the table, really wanted to aim at let's make sure that CalFresh, whether you're undocumented or not, you're able to qualify that program. You're able to get benefits and get an EBT card for your family. And that's how we came up with Food for All. And you'll notice a pattern with the names of these campaigns. health for all and food for all and safety net for all. We're really, going with all and making sure there are no exclusions. And this is just a kind of a summary of the whole trajectory of this policy. The story really starts with the personal responsibility and it's also known as welfare reform that passed in 1996. And what it did was it removed eligibility for a lot of categories of immigrants from accessing SNAP. One of those populations were lawful residents who haven't resided in the country for 5 years. And so they haven't met what we call now like the 5-year bar. And in response to that, immediately after welfare reform was passed, Californians came together to make sure that lawful immigrants who have not met that 5-year bar could still access food stamps or CalFresh. And so they created the California Food Assistance Program for kids and seniors, so below 18 and over 65, that would restore eligibility for people who have not satisfied that 5-year bar. In 2000, the next year it was expanded to all ages. And then by 2000, it became a permanent program. In terms of the CFAP policy, nothing has changed since then. In 2014 and 2017, there were some efforts to expand CFAP in some way to DACA and TPS holders, but there wasn't really any movement there. And Food for All really launched in the beginning of 2021 when we partnered with Senator Melissa Hurtado to author Senate Bill 464. And 2 years later, we were able to secure a budget investment to expand CalFresh to all Californians over the age of 55, regardless of immigration status. The caveat here is we don't have an implementation date, which is unfortunate. We're trying to get clarity on that as soon as possible. But we're hoping that this is something that we can get by 2024, 2025. But really, we're trying to get clarity on that because they have to change all of the systems behind the scenes to make this expansion happen. This slide just kind of introduces the author I mentioned, Melissa Hurtado of the Central Valley, and she authored Senate Bill 464, which was kind of like our model legislation, which was partially included in the budget. We also worked with Assemblymember Miguel Santiago to advocate for Food for All in the budget, and he represents parts of Los Angeles. And then the Food for All Coalition has 115 member organizations, which include anti-hunger, anti-poverty, immigrant rights advocates, and grassroots organizations. And as you can see by the sample of logos of our partners, we really try to make this representative of different regions across the state to make sure that we're meeting the needs of all folks across the state. This is a picture of we had a press conference in Los Angeles at the LA County Regional Food Bank, and this was our first in-person event this year, so it was really a milestone for our campaign. This was right after the May budget revision, and we were really trying to push the governor, who had committed to Food for All 55 and over, to go for all. So you can see our budget champion there, Assemblymember Santiago, and all of our community members and community health workers who were really there to advocate and be the voice of their community. Yeah, and so this is just I'm just going to give a recap of the budget wins over the 2 years. In our first year, we secured some money to start getting our system ready and automation. And state leaders started to they made a commitment to phasing in by age group funding for this expansion. And we began working with the California Department of Social Services to start tracking that implementation. And I think we're really seeing this come together so that if we get further budget investments, our state is ready to provide this benefit to additional populations. And this past year was our largest win so far. And as I said, California committed to expanding CFAP, which will be known to consumers as CalFresh, to residents older than 55, regardless of immigration status. And this is historic because this means that California will be the first state in the nation to provide food assistance to any undocumented population. And in this case, it's going to be undocumented folks over the age of 55. We expect that this is going to help an additional 75,000 Californians each year. But we recognize that there are hundreds of thousands of folks under the age of 55 who there's no commitment to providing those benefits for them. If folks are interested in, giving input with our state agencies on this expansion, we do have a stakeholder session scheduled for November 16th, 2022. There's the contact here, cfap@dss.ca.gov if you want to get on their mailing list. But you can also connect with me after this webinar and I can make sure to direct you in the right direction. And as I said, there's still a huge gap. The Legislative Analyst's Office estimates that there's between 690,000 to 840,000 Californians who would qualify for CalFresh based on their income, but are excluded due to their immigration status. And so we're really thinking forward to our next year's campaign. We're thinking through how do we close this gap? How do we get to that full, 840,000 folks getting access to CalFresh? And we've been meeting with our coalition to kind of develop our policy strategy. And if you'd like to stay updated, I recommend you visit our website, caimmigrant.org, where we have a page for each of our campaigns, and you can get resources and updates, or follow us on social media at CA Immigrant or Cal Immigrant on Twitter. One more thing, we have a webinar next week on Wednesday, October 18th, where we will be going over the successes, challenges, and lessons of this campaign. So if you are even more curious about how this happened and how you can kind of plug in, you can visit bit.ly/F4A_webinar. And we can include that, and I can share that with the organizers of this webinar to provide for y'all. Thanks, and now I'll hand it over to Daniela to get us started with with Safety Net for All.
Thank you, Ben, and thanks, Yvonne. Good morning, everyone. My name is Daniela. I'm the policy coordinator with the Economic Justice team at CIPC. And part of my role has really been the Safety Net for All campaign, which I'll get to in a little bit. But maybe and I know that through the survey results, thanks to everyone who filled one of those out, that most of you on this Zoom don't know about Safety Net for All, which is also exciting because we get to share this information with you all and kind of bring you up to speed with some of the advocacy efforts that are going to support some of California's most impacted families. So if someone could go to the next slide, please. Thank you. So similar to what Ben and Yvonne shared earlier, we know that there are longstanding exclusions that really prevent immigrant families from accessing resources that could make a huge difference in their quality of life. The one that I focus on really is unemployment insurance or unemployment benefits for some of California's most impacted members. So we know that during the pandemic, a lot of immigrant families were forced to work in really unstable and dangerous conditions. There was actually a report that investigated and found that immigrants accounted for 58% of pandemic-related worker deaths in California's highest risk industries. So warehousing, agriculture, food processing, wholesale trade, restaurant and food service, nursing care, landscaping, grocery work, and building services. So we know that folks in those communities were really forced to stay in those jobs because they didn't have access to a safety net like unemployment insurance that could really help them make ends meet, like it helped millions of other Californians. So one of the things that we also know is that the numbers are there, that 1 in every 16 workers in California are categorically excluded from unemployment insurance because of their immigration status. So the numbers, I think, are around 1.1 million Californians who don't have access to unemployment insurance, while we know that they contribute roughly $3.7 billion every year in state and local taxes, yet never really see a cent of that benefit. Additionally, we know that unemployment insurance is part of it is funded through California employers who contributed around $459 million in unemployment insurance taxes on behalf of undocumented workers every year, even though those workers don't see a cent of those benefits. So one of the things that we're really trying to address here is removing those exclusions to ensure that excluded immigrant workers do qualify for unemployment benefits. And that's kind of where the birth of the Safety Net for All Coalition came about. If we can go to the next slide. So the coalition it started in 2020, although conversations around expansion of unemployment benefits have been around for years. We are a coalition of over 120 membership organizations, community-based organizations, different policy organizations. We have co-authors, legislative support, whose sole purpose is to extend unemployment benefits to excluded immigrant workers and ensure that there is a program that can support families when job loss occurs. And we know that that can happen at any time, right? People are still feeling the effects of the COVID-19 pandemic. People are still getting sick with COVID. But in addition to that, we know that disaster can hit at any moment. We saw the Tubbs fire in 2017. We've seen right now in Florida, right? We see Hurricane Ian. We're seeing the effects of climate, right? And how at the end of the day, the families that are most impacted when disaster hits are immigrant workers. So we're really trying to make sure that they're through Food for All, through Health for All, through Safety Net for All, that those families that are most impacted have the safety net that they need to make ends meet and hopefully find a way to thrive as well. Can we go to the next slide? Thank you. So our 22 campaign was AB 2847, the Unemployment Excluded Workers Pilot Program. What we proposed in the legislature was for $300 for up to 20 weeks for excluded immigrant workers. So those workers that don't have any documentation status that work in whether warehousing, whether they're day laborers. A lot of our communities were also members in our community were household workers. So we really tried to build a piece of policy that would make sure that the diversity in work that exists within the immigrant community could apply for these benefits that we knew could make a difference in their lives. And we had a lot of support in the legislature. We had 56 members in the assembly who supported us, 31 in the 7, and 13 co-authors. So we know that this is a program that members in the legislature see as important and see as something that should be uplifted. However, in late September, Governor Newsom vetoed the bill. So Unfortunately, it did not go through this legislative cycle, but that doesn't mean that we're not going to continue to fight. Yvonne mentioned Health for All has been an 8-year process. And I think one of the key things to share here with you all is that there are advocates, there are community members that are organizing to ensure that some of California's most impacted families have these policies, have policies that actually support them and really can make a difference in their lives. So can we go to the next slide? Next slide. So one of the things that you all can do if you'd like to know more about the Safety Net for All Coalition, kind of track the unemployment benefits extension to immigrant families, you can definitely sign up for our bit.ly. It's in the presentation that Leah is sharing, but you can also contact me if you're interested in learning more about what it means, or if you're, let's say, like a policy fanatic or a family advocate, and you're like, I really want to make sure that in the next bill, the next policy that's developed, these people are, these communities are included or centered. We love to have that input, because effective policy that is community-based, that is community organized, we know is the most effective policy in supporting the communities and the families that we work with. So that's kind of it for Safety Net for All. We're still in the transition phase, kind of looking at what next year looks like for us. We know that we're going to continue to push for extending unemployment benefits, whether that looks like a pilot program like we proposed last year or a permanent program is still to be known. So if that's something that you're interested in learning more about, just sign up on our bit.ly or reach out to me, as I mentioned. But that's it about Safety Net for All. I hope that this kind of provided some insight around the work that's going on in the immigrant rights field in relation to immigrant workers and the communities that we work with. So thank you. And I'll pass it back to, I think, Leah or Diana, who's going to be supporting with questions.
Yeah, thank you so much. I just want to say really quickly, thank you, Daniela, Yvonne, and Benjamin, for this really important update. Research shows that the health and well-being of young children is closely tied to the health and well-being of their parents and caregivers. I'm really just highlighting the importance of policies that advance access to basic needs for all families. So really thank you for today's update. And with that, we'll open it up to questions. I know there was a question in the chat from Jamila on the interview process for CalFresh. And Ben, do you want to give an update on your response? And it looks like others also had.
Yeah. So the model that the CalFresh program uses to apply is click, call, and connect. So when folks apply, I encourage them to go to getcalfresh.org or Benefits Cal. And once you submit your application, county workers then verify your application and see if they need additional documents. And I believe they can do interviews over the phone or in person. And I imagine they must have had to do it over the phone for majority of cases over the past 3 years because of social distancing. So though, I'm not an expert on the actual eligibility process. I focus mostly on the determination process. I focus mostly on the policy side, but I just encourage you to connect with the Alameda County Office of Human Services or whatever agency administers CalFresh in Alameda.
Thank you, Ben. And it sounds like Deepti also, her experience has been that they do interviews over the phone, but that's a really good question. Thank you. Any additional questions? Feel free to type it in the chat or unmute yourself. All folks think of a question. I have a question for Ben. I was really shocked by the 64% of undocumented children that are experiencing food insecurity. And I know just like access for the whole family is really important, just in terms of basic needs and benefits. I was wondering if you could say more about why that percent is so high and what kind of programs or benefits are undocumented children eligible for.
Yeah. In terms of, why, I would attribute a lot of it to the exclusion of undocumented households from those benefits. As I said, CalFresh is a monthly benefit that you use to purchase things. And so families lose a lot of purchasing power by not having access to an EBT card when they're low income. And I think just across like what we see nationally is that households with children, especially young children, experience higher rates of food insecurity. And I just imagine, I don't know, I just imagine raising a child does take a lot of resources. And what really shocks me is that like, the way that I just imagine parents really put a lot of energy to make sure their children don't go hungry. So when children do experience food insecurity, it's like, that's recognizing that parents have tried their hardest, maybe even prioritizing their children's meals before themselves. And it's like, that wasn't even enough to kind of create stability for the whole family. So I think a lot of it kind of goes back to, just income inequality, access to less resources. I will say that, with pandemic EBT for school children, that is available to all children who qualify for free or reduced priced meals or CalFresh. And undocumented students qualify for free meals. So a lot of households have gotten those emergency food benefits over the past couple of years, but the pandemic EBT for young children under the age of 5, so like childcare age, that eligibility is based off CalFresh enrollment, and undocumented households and children don't qualify for CalFresh. So there are young children who aren't getting pandemic EBT 3.0. And WIC nutrition benefits are available to everyone regardless of status. So there's some programs that are available for children, some programs that are not. But we're seeing that the exclusion is kind of having an impact on those numbers that we saw.
Thank you for that. I see 2 hands up. Eleazar, am I pronouncing your name correctly?
Yes.
You're next.
Hi, good morning. My name is Eleazar Cuenca and I work for Bay Area Plan Leadership Action Network. We work mostly with undocumented people. So my question is, I don't know if you came to do this kind of workshop with our parents here with us. This kind of information, because it's so really important for all our parents.
I'm seeing head nods from Yvonne and Daniela.
Yeah. Given if we have capacity and time, I don't see why we wouldn't be able to give another presentation to people.
Okay, so we can communicate by email. So if see the hours and dates and time. So how we can reach out to, I don't know, directly person to schedule or reach out.
If you want, you can email me, Eliazar, and then I'll go ahead and connect Yvonne and Ben to coordinate and see what works.
Okay, thank you, Daniela.
That's great. All right, Deepti here next. And please correct me if I'm pronouncing names wrong.
No, you're pronouncing it great. Hi, everyone. Thank you for this presentation. My question is not directly related to what y'all were talking about, a little bit different. I was wondering about CalWorks. So I was at a presentation about CalWorks, and they were talking about about enrolling for 4Cs once you are eligible for CalWorks. And What I was kind of surprised that children who are eligible for CalWorks because they are citizens or they are documented, but when their moms are not, that they are still not eligible for 4Cs childcare, for 4Cs through Alameda County or any other kind of childcare benefits, because it is the mom that is receiving the benefit, not the child. So even though the child is documented, because the mom is undocumented, they don't receive that. They're not able to use that benefit. Just was wondering if you all had any insight into that and whether there's any work going on to sort of change that.
I guess I can take this one. CalWorks. So just addressing the exclusions of CalWorks, we don't have I don't have any updates to share with you. Like there's not a like a cash assistance for all sort of like program, though that is a good idea for another program. But I'd be interested to learn more about the 4Cs program. I'm not familiar with it. Is that like a county thing?
I don't know what the statewide program is called, but in Alameda County, and I think, I mean, you all, the organizers of this webinar probably know a lot about it, but 4Cs is Alameda County childcare benefits program. So if you are eligible for CalWorks, then you also get connected with childcare, because then that whether the mom wants to go and study something, even if it's for an hour a week, they can still get eligible. They are eligible for childcare benefits, and it's a really like great program because it offers child support for even for the entire week, as long as the mom is engaged in certain small number of hours of whatever studying or work through the week. So it's a great program, but then the fact that children who are who are documented can receive that cash aid, but the moms are not eligible for who are undocumented are not eligible for the same childcare benefits. So it sort of leaves these kids kind of, although they are receiving cash aid, they are not eligible for childcare.
Right. I wasn't aware of that, so I'm definitely taking note of that and seeing. I'll look into it. I'm wondering if that's a statewide, if that eligibility based off the parent receiving CalWorks, if that's like a state or federal statute.
I imagine it's probably federal because it's a TANF program. So thank you, Deepti, for highlighting that. That's an important gap that I don't think has been a center point of advocacy. So it'd be something good to look into and see if there are any efforts, either national or statewide, where they're lifting this up.
But I hadn't considered the effect that had on like the following childcare services that are available for CalWorks. And we know how much there's a lot of value in getting childcare, and it helps a family do a lot of other things. Thanks for sharing.
Yes, thank you. Any additional questions?
I see a question in the chat about CalFresh generating economic activities and stimulates local economies. I'm not an economist, so I'll explain this the best way I can. I think for me, I think about like that, like the stimulus checks that a lot of us received during the pandemic, were intended to encourage folks to spend and circulate money through the economy. And CalFresh has a similar effect, but on a more regular basis, because people are routinely spending that EBT card at a grocery store, at a cash register, and those businesses receive funds from the customers who use CalFresh, and they use that money to pay their workers salaries and their benefits, and then those workers use that to pay their living expenses, and it just continues that flow of money and generates business in a local economy. And there are a lot of different vendors who use CalFresh or EBT in California, beyond big corporate grocery stores. So it can also support local businesses who are CalFresh vendors and help their customers afford to pay for their goods and services.
Thanks for that. Any additional questions, thoughts, areas where there may be a need for additional advocacy?
Deepti has her hand up.
This may not be something that you all directly work with, but I was just thinking about, how both EDD and EBT are both kind of nowadays very prone to funds being hacked and people losing money from their cards. So just wondering, I feel like it probably impacts people who don't have English as their first language more adversely. So I'm just thinking, have you all thought about this? Are there things that you all are doing? Is there any kind of any protections being thought about? And I don't even know if this is something that is part of your advocacy work, but just have that thought.
Yeah, I can take that one, and then maybe Yvonne and Ben, if you want to hop in. But in most of the bills or policies that we propose, we also include privacy clauses to ensure that because we know that the communities we work with are immigrants and are undocumented, so we would hate for any of their sensitive information, right, or for them to be targeted by federal laws or ICE, because we know it happens, right? So in each of when we propose the bill, we include privacy protection. So for example, for the AB 2847 bill with ED, and it would have been an EDD program, we stipulated that at the end of the program, all documentation would be deleted, erased, so that didn't exist in an either, where then folks can go back and be like, oh, these people are undocumented, right? So those are one of the things that we did. But we also, there are advocates within EDD that work with us to ensure that the program that's going to be implemented does address those security concerns as well. So it happens within the process of moving the legislation forward as well. But that's a great question, because it's valid, and a lot of our communities, it's a fear that they have, right? I'm giving you my information, what's going to be done with it. So it's something we try to be very intentional about, so that folks feel safe or even are willing to apply, right? Because that's another thing that we see as well is folks know that the benefits exist, but are afraid to apply. So that's something that we also try to address and make sure that we're on it. Yeah, but Yvonne, Ben, not sure.
That was similar to what I was going to say about just protecting folks from being hacked. There's some privacy protections, and we've clarified that all information collected is only to be used for the purpose of eligibility determination. Sometimes it's shared with the corresponding federal agencies, but that's only for verifying that the program is that they're concerned with fraud and making sure everything is running smoothly in quality control, not immigration enforcement.
Yeah, that last bit that Ben mentioned about immigration enforcement is always something that comes up for folks are willing to any public benefit, but as it relates to Medi-Cal, folks are always like, well, can this be shared with federal officials or ICE or anything like that? But there are very strong privacy protections, like Ben said, that does not allow that, does not permit that. That has never happened. We've never heard of a case of the federal government coming in and asking for specific information on undocumented people in health coverage. They technically could in super rare cases of terrorism or something like that. That's never happened. We have not heard of a single case of that ever happening. But yeah, so I would say, yeah, it's very protected. It's, not to be shared with any federal immigration service, I should say, but yeah.
And then I will say that our upcoming training on the 26th, the immigration update with the IIBA, will also be covering a little bit of any developments in public charge. So if people are interested in learning a little bit more about that, they can attend that training or look on our YouTube channel, and we'll have it up after the training ends.
I see a question from Adriana in the chat about someone just came into this country. How can they be best connected to having health insurance? That's a good question. The long answer is it depends on the county that you live in, really. I mean, most counties I would assume have, health centers or community clinics, and most of them do enrollment services into not only Medi-Cal, but, also CalFresh and other services. So I would say if they're connected to a health center, they can definitely go about it that way. There's also a new website I'm putting in the chat, Benefits Cal, where you can apply for, I believe it's Medi-Cal, CalWorks, and CalFresh, right? Online, you can go on there and it directs you to the county specific website if there is one. Some counties use their own system, others just use the statewide one. And so I would say that might be the best way to go about it. What if they're a minor in Alameda County? Same process. They would still, apply just like anybody else. The eligibility rules for minors, I'm not sure about CalFresh, but for Medi-Cal, it's your family income can be a little bit higher as for a child at least to qualify. So you can earn a lot more, and your child may qualify. You may not as an adult. They're very strict with the income limit, but for children, your household income can be a lot higher, almost double, I think, and your child may still qualify. So more likely than not, anybody under the age of 18 qualifies for Medi-Cal. But you can do that again by going to a local county. You can go to a local county office. I'm not sure what county department runs Medi-Cal. In Alameda, here in LA, it's the Department of Public Social Services. And so I would say you can go directly to the county office that administers Medi-Cal, go to a local clinic, or any of the health centers around town, or just go on their website to sign up for benefits. So yeah.
And I'll add that Help Me Grow is a great resource, and alamedakids.org as well. Folks can help connect families to resources.
Are they each separate applications? That would, I think, depend on your county. The website I put does link to a unified application, but I think it might depend on the county that you're applying in. Honestly, I'm not quite sure if they're separate applications or not. Yeah, so depends on your county is my answer.
I think on Benefits Cal, you can put your information in once, and it then automatically applies for the benefit programs that you're eligible for or might be eligible for.
Yeah, thank you for that information. Any additional questions? These are all great questions.
One thing that we didn't mention that we sort of got into is public charge, and Ben knows way more about this, but the new public charge rule was finally put out a couple weeks ago, set to go into effect in December. So these benefits, won't count against the public charge rule. And there's still a lot of confusion and a lot of, fear of enrolling into benefits, but, that's no longer really a threat. At least for Medi-Cal, it never really was, even with the old attempted rule under the Trump administration, because this Medi-Cal expansion is just from state dollars. So no federal money goes into it, but still a lot of fear and hesitation around in our communities, but we want to put out there that isn't the case anymore. It's being made very explicit what does and does not count. And, Medi-Cal and CalFresh definitely don't count for that, or safety net for all, for that matter.
Yeah, I just wanted to link Alameda County Department of Social Services has been actually a really strong partner in communicating about public charge, and making sure that immigrant communities have accurate information about how many of these, most of these programs, aren't counted in a public charge determination, especially as Yvonne mentioned, Medi-Cal, CalFresh, and unemployment insurance. So I've linked a web page on their site that has a immigrant resource guide. It's in English, Spanish, Arabic, Cambodian, Cantonese, Dari, Farsi, Korean, Mandarin, Tagalog, and Vietnamese. And it's very county specific. And I think it's like a one-stop shop on all the information related to immigrants. And then I'll also share a public charge guide if folks would like to have that handy as well in the chat. But the message that we're encouraging people to tell their community members is apply for the benefits that you need. The only benefits that may count are cash benefits, but to qualify for those cash benefits, you oftentimes have to be like a green card holder already. And therefore, green card holders don't have to worry about public charge. So people should just be applying for the programs that they qualify for.
Thanks for that update. Anything else? We're happy to stay on and answer additional questions. Also, we'll put in our emails in the chat just in case anything else does come up. But again, just want to highlight our next training that Leah will share more about, that shared details about earlier today. It's happening on the 26th, and there's a link in the chat. Thank you all for joining us today. Leah, do you want to do the next steps?
Oh, I actually see one last question.
Oh, okay, perfect. Keep the questions coming.
Alexia. It looks like where can families check if they are available depending on their income for food stamps? I think that means eligible. Yeah.
Yeah, I put two different websites. One is getcalfresh.org or benefitscal.com. And then it has all the information about the programs, and you can submit an application and it'll tell you itself. There's no drawback for applying and getting denied. So I just recommend, folks look at that website and fill it out for themselves or their community member or family member.
Yeah, and Cynthia added information on the chat. East Bay Agency for Children also helps connect families to Medi-Cal, CalFresh, and CalWorks. And there's additional information in the chat if folks have any questions.
Okay. Well, it seems like maybe we've run out of questions. This is everybody's last call for questions. Of course, if you have questions after the fact, you can email them to me, and then I'll get them to the presenters, or we'll find a way to connect you. Well, I'd like to thank everyone so much for coming today. We really appreciate your time and attention, and also the speakers, Yvonne, Benjamin, and Daniela, and also Diana for being our MC today. Thank you so much. Really appreciate you all.